Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Sara Helvey. She's Chief Clinical Information Officer at Care New England, and Dr. Rajeeb Khatua. He's Chief Operating Officer at ReMedi Health Solutions. Welcome.
Thank you.
Yeah,
So really glad to be here.
yeah. Thanks, John. Really
Yeah,
excited to talk to you.
it's one of my favorite things talking about go lives and making it work and effective and how do you train the doctors to be effective in their use of the EHR. It's such an important topic. So lots to dive into here. But before we go there, why don't you start, Sarah? Tell us a little bit about yourself in Care New England.
So I have been at Care New England for about a year and a half. I was brought on when we were sort of starting our transition from we were a half Epic, half Cerner shop to becoming a full Epic shop. And prior to that, I was in my preventive medicine residency at the University of North Carolina for a couple of years. And prior to that, I was a consultant in healthcare IT for 10 years, and I traveled all over and I was performed in various positions from even being go live support all the way up to being a CMIO. And I'm happy to be here today to speak with you.
Awesome. And Rajeeb, tell us about yourself and Remedy Health Solutions.
Sure. So I'm a family medicine physician. I made the transition to healthcare IT about 16 years ago. I was a former regional chief medical information officer for Northwell, and soon after that, I was assistant CMIO for New York City Health and Hospitals and led their Epic install. Just at Remedy Health Solutions, I'm the chief operating officer, and our company does professional consulting services around the whole EHR lifecycle, so all the way from the beginning of system selection through the whole implementation process of change management, operational readiness, training, go live support, personalization, and once you've been live for many, many years, we also do a lot of optimization as well.
Awesome. Well, as I mentioned, we're going to be talking about your Epic Go Live, Sarah. Obviously, you've been integral in that, with the support with Remedy Health Solutions. But I'd love to maybe start off with you, Sarah, and hear like what were some of the key goals you had to really ensure that your physicians across, all of the different specialties that you have at Care New England, how did you make sure that they were ready for your Epic Go Live?
Well, I think we did. I don't know that we necessarily did anything unique or unusual that you see all the organizations do, but we really did, of course, want to focus on training. We wanted to
Hmm.
focus on, Epic promotes personalization. Epic is a very customizable product. So our personalization labs were also very important to us. One thing that we decided to do, as we'll talk more in this is the discussion today, is we wanted to bring in some experts to help our providers with customization and personalization of the workspace. We felt like that was going to be key to getting our providers prepared and ready for the go live. And I think,
Interesting.
yeah, and I think what I would just also add is that we did try to make our training plans be workflow appropriate. I think we've all heard that. Anybody who's been in this space long enough knows that providers are going to come out of the training, or at least a couple of them will, and say it wasn't applicable to my day-to-day life, which is a valid concern. But and we did try the best we could to make that a part of our training plan as well.
Interesting. I mean, you're right. I've heard that from so many doctors. They go into a training, especially specialists in particular. It's like, I never do that workflow. So why were you training me on that? Or, I needed a different way workflow. You should have trained me on that, right? We've seen that happen with a lot of go lives. You took a kind of three-phase approach to your go live, kind of the pre-go live personalization that you kind of mentioned at the elbow physician support, but then also like the post go live optimization. Tell us more about that and that decision to kind of to do all three stages of approaching your go live and making sure the training and personalization was done well.
Yeah, well, and honestly, it is an epic requirement. So we were fighting against that. We have a board who had, we have our strategic goals for the year, and one of their goals was to have 90% of providers personalized by the time we went live on Epic. So we had
Wow.
that initiative as well. But just on top of that, we we just decided this is the best thing, the move for our organization to get our providers prepared. As I mentioned, training can be somewhat generic, and that honestly bodes true, but there's a reason for that because it's very difficult to train when you have a surgical class to train to every surgeon who's going to take that class. So our avenue was to train them, get the basics in the class, understanding that we were going to send them to personalization with these experts that we brought in from ReMedi, who were going to put the icing on the cake, if you will, the cherry on top, and to help them work through those specifics that they needed for their workflows.
Interesting. I mean, it's amazing your leadership was so forward that like, hey, we want this personalized for 90%. That's a pretty ambitious effort, but I guess maybe they knew because you're a half Cerner, half Epic shop, they knew what was needed for them to be successful on Epic. I imagine that went into it.
Yeah, and I just also wanted to add that the uniqueness of being Cerner, half Epic, we had a lot of providers who were number one, were already experienced with Epic in some
Mm,
capacity. And then number two, we have a lot of providers that work at our geographical location. We are surrounded by Epic shops, and a lot of our
gotcha.
providers also work at these other organizations and come to ours as well. So we had a ton of providers with experience, and we wanted to really just emphasize what they already knew while adding on Care New England specific workflows and things that we needed to teach them, things that we wanted them to show. Like, for example, we've really pushed diagnosis aware notes at our organization and problem-based charting. So that was one thing that we wanted to call out, and personalization. And then just to kind of circle back to our pre, during, and post, I mean, we felt all of that was important to solidify the knowledge of the providers. As you probably know, and I think Rajiv would also attest to this, just getting one personalization lab before go live is just frankly not enough. No
Mm.
matter what the system is, even if you know Epic, once you get in there, you need a little bit of at the elbow to learn those nuances of every system. And then it really is benefits you to have a secondary personalization lab to really pull it all together. So we just felt all three was really important.
Amazing. Rajiv, what would you add to what she described about the experience and kind of this three-phase approach?
Yeah, I mean, I think, we grew up in healthcare IT and watching so many different go lives over the many years. And, I think training is one of those things that, we do put a focus on at go live, but it can be done much better. And that's kind of where our program kind of evolved from, especially with the physicians on the personalization front. So I think Sarah mentioned, the pre-go live sessions. I think what we try to do there, and we take a workflow based methodology of building out the tools. So just imagine you're kind of you're inpatient, you're admitting a patient. So just kind of walking through that workflow. So all right, let's go put in your admission orders. Let's set up that admission order set to what you do use most of the times to reduce those clicks. And then, we got to write that admission note. So let's get that template up and running. And, that's kind of overall like kind of how we go about it. And then obviously real life happens. A lot of physicians kind of feel like they're all set up right before go live with all their tools, but real life happens and they get a kind of understanding, okay, maybe that idea I had or the guidance I got, and maybe we can tweak it a little bit better to make it more efficient. So it kind of bolsters on afterwards to make sure that it's really solidified and they're kind of just like really ready to go. One of the things that the reason we go through the workflow based methodology is it gives another touch point of actually really kind of focusing on how you're going to use the system from day one. And that really boosts the confidence for the physicians when they actually go take care of patients in the new system. And I think Sarah mentioned, a lot of people around the area, I think they had a test out process.
Mm.
So they did not get that training from the traditional training. So this personalization, I believe they made it mandatory for everybody. So this was another opportunity to get those people aligned to the Care New England specific workflows. So I think just overall, it's just kind of we look at it as a program and as in partnership with Care New England to kind of get us to kind of where we need to. So it was one of the great things was they shared all the training content with us so that we could make sure our team was aware of what they wanted to do. We also kind of went through a process of getting the service line leads, get them personalized first, set up some of the base templates, and that makes the following sessions a lot more efficient because the base content's already there. So it's just the program over many years. We just know how to kind of make it run very smoothly and get the most out of it.
Yeah, you're taking me back to when I was in a practice implementing EMRs. I would always onboard the physicians, and that was how I did it, the workflow. So it's interesting that it's still the key way is to show them the workflow and let them experience it, and it is so powerful. I find it also interesting. You guys had a number of real-time dashboards that you created, Rajeeb. Tell us about those, and what data did it show, and maybe to share some of the results of what the final data looked like.
Yeah, so to kind of build out our dashboards, we kind of do a lot of documentation to make sure that we capture the right data. So the first big piece is kind of the registration. Epic has a foundational good install credit for reaching an essential level of personalization. So that's basically getting one note template or one order component completed. Obviously, hitting the checkbox is not enough, but we just want to make sure that those metrics are hit so that Care New England was able to get credit for that. And I believe we hit about 99%, right, Sarah?
Yes, that's correct.
Yeah, so that's one piece of and to get that information, we do run these personalization sessions virtually. So we created a bookings application where physicians can kind of schedule their own time. And there's also the ability, if they have a practice manager that manages their Outlook calendar, they can schedule them and it'll also go on their calendar as well to give them the reminder you have a personalization session coming up. But we have that, so we're able to track unique providers that have registered for the sessions. And then when we get into the sessions, we have a robust form that our physician informaticist fills out to kind of document what was done in the session. And that form kind of really matches up very closely to the training documentation in Epic Signal. Obviously, Signal can't be used at Go Live because there's not enough data, but it's just something that Care New England can use in the future. And the
That's
third
awesome.
piece is we sent right after the session, we send out a end user survey. So that's where we capture data of kind of like how the physicians felt about their sessions, their satisfaction, what their confidence level was before the session and after the session. And that's where we kind of saw um, a lot of improvement. So we're looking at about like a 7.1 rating for our readiness before the session. So that shows the training was done pretty well. But then they felt an 8.8 out of 10 after the session. So it really, really did improve their confidence going into the Go Live.
That's awesome. I want to dive into some of that readiness score that you just described, but before we go there, Sarah, how was it for your organization to be able to kind of see this data in real time as you prepared for your Epic Go Live, and how did that help you in your decision making process and in making sure that you were prepared to go?
Yeah, I think ReMedi was able to help us in a lot of different ways and some things that had come up that maybe they weren't used to dealing with that they were able to pivot pretty easily with us. One example is, as I mentioned, we have a lot of providers that go to other organizations. We have Brown affiliated providers that use Brown emails. And when we're trying to send out communications to get them to sign up, they're looking at a Brown email and not what we send to them on our Care New England email. So we were able to use ReMedi, one of their platforms, to get out text messaging to them. And so when it came to data, yes, we were monitoring the sign up phase of the personalization labs, making sure the spots were filled. As I mentioned, the initiatives, our strategic goals was to have 90% done by pre-go live, right before go live. So we were able to look at that dashboard real time. We were able to send it to our board to make sure we were on track. We used the data to, again, make sure we were on track. We also, because we have a half Epic, half Cerner shopper, we did at that time, it actually presented another unique challenge that we could not push in a lot of our build. So what happened with one of the early things we were dealing with was that we had a lot of technical issues. And so
Mm,
we had a lot of people that had to cancel. And I think ReMedi also was able to pivot with us to, put out those fires of the providers that were unhappy, but we were able to use their data to find out who had a technical issue, how can we get them back in. We were quickly able to get them back in. So we were able to really track where we were the entire time. So those are a lot of the ways we use the data, aside from even post go live, looking at our numbers, seeing if they're making our Epic good
yeah.
install. So we used it really every step of the way, and it was a really nice dashboard, it was clean, user friendly, and our board was really happy with it.
Gonna say it's probably leadership that most happy because they always wonder this is oh it's happening, we've invested a lot, but what's really happening is probably always their question. That's interesting. Rajeeb, you kind of mentioned this readiness score that you did and this measurement from the physicians, which I find really fascinating that you're like, are they ready for this experience and how has that changed because of the training? Tell us more about why you decided to do that. And also I'd love to hear you went from a 7.1 to an 8.8, I think you said. Like, how different is the experience for someone that's at a 7.1 versus an 8.8?
Yeah, so the reason we kind of went with the scoring to get an understanding. So we have two kind of questions about how they about their kind of feelings about how they feel, how prepared they feel. One is like, do you feel more confident after the session? And I think there was like around 97% that felt more confident after doing the session. But we also wanted to get some kind of a scoring mechanism to kind of understand how they truly felt internally after training. Because a lot of times, you may be trained, could be way before the go live, and you forget a lot of things, or they just feel so overwhelmed because it's a lot of information being dumped on them, and they just don't feel confidence because they're not able to see the big picture and put it all together. And so that's why we kind of took that scoring of like how did you feel before and then how did you feel after. And the reason we kind of went with that is because we wanted to see if kind of going through like a workflow based methodology, getting them an understanding like, hey, you know what, your MA at the front desk is gonna do this. This is how it impacts you. And and then also building out the tools at the same time kind of shows them how it could have been if they didn't do personalization, but now that they've done it, there's a lot of efficiencies built in, reducing clicks and making things a lot easier. So that's kind of how we kind of decided to go with that particular scoring. I think it was like as you mentioned, it's a 7.1 to an 8.8. And what does that really mean? I
Yeah.
think where we kind of break it down is like zero to four is like I don't I different levels of not feeling prepared, and then
I'm overwhelmed.
five five to seven is like I think I can be okay, but like 8 to 10 it's like okay, I'm ready to go, I'm excited about this. So that's kind of where we kind of describe the rating to them when they kind of fill it out.
Sarah, I'd love to hear your perspective on this. And to be frank, I mean, you had really tremendous, involvement from your physicians. Like, help us understand like what was key to getting that involvement and that buy-in from physicians. Because in, some organizations we don't see that, even though there's lots of studies like Class Arch Collaborative has studied it, extensively that having the personalization and the training makes all the difference in their joy and happiness and using it, let alone the efficiency. But what was your perspective on this?
Well, I think this is another way for that we were lucky in that we had we had some internal incentive from all the providers just for the fact that they were really tired of being half Epic, half Cerner.
Hmm,
Those two
interesting.
those two platforms do not play well in the sandbox together. They don't communicate well. So there was a long-term position of a lot of our providers of frustration. So we just had some natural excitement about this transition. That also, and again, the whole situation of them being in the community, they use Epic here, they use Epic there, so they just like Epic as a whole. So we had that buy-in as well. And I think just maybe the personalization and stuff that they did at their other organizations, they also understood how important it was. as Rajeeb mentioned, we had a bunch of providers test out. I think it was close to 40% of our providers
Wow.
tested out of training. So it was a huge number of our total that had familiarity with Epic, such familiarity that they were able to test out and get into personalization. And I think that a lot of them even recognize, and again, maybe it's just the community of providers that we have here. I feel like they've always been very easy to work with, and
Mm.
they're they know what needs to be done and they do the work. So we also had some really great clinical champions that came to the table for us. I mean, because that's part of it, right? When you've got the people at the top that are on your team that'll push the initiative forward with you, then you're going to get buy-in. So we had all of that. And then again, I mean, there's a lot of reasons I'm listing here, but I do think that Remedy, their team, being providers, when we told them that you're going to be personalized by another provider, they were really excited about that. And there's just that colleague to colleague level that you don't really get necessarily if you're, I think trainers can be excellent, but it's just a different dynamic when you have a physician teaching another physician or just a provider teaching another provider. So that was something we were excited to offer and they got excited about that. And so those are one of many reasons why, it was pretty, I would say, wouldn't say easy. It's never easy, but it made it
Yeah.
a little bit easier for us to get the providers to come and sign up and then come again actually and just realize how important it was to do these personalization labs.
Yeah. Are you seeing that, Rajiv, across other organizations? Because I mean, Epic is, so widespread in healthcare that, when you're doing a go live, many of the physicians have already used it, whether it was in their training or another organization. Is that becoming a popular thing that you see as you do these go lives?
Yeah, I mean, I think Epic being out there for so long and in so many different places, yeah, I mean, I think almost every physician has that had their run-in with Epic somewhere.
Sure. But they
Either in
probably still need the
residency.
personalization of the
Yeah,
organization. Is that, kind of what you experience?
yeah, they do. And, we also have been seeing a lot of kind of Epic to Epic transitions as
Mm.
well. There's a lot of acquisitions going on out there where, one health system's buying another. They got two instances of Epic. They want to consolidate into one. But a lot of the personalization they may have done in the past doesn't really carry over into the new instance or the other instance. So
Sure.
there's an opportunity there to kind of build those tools out. And then also kind of with the advent of AI right now, one of the things that I hear from CMIOs is, ambient AI is great, but there needs to be updates to the null templates to be able to, especially with the integrated ambient AI tools, where to pull in that information to the right place in the notes. So we've been seeing a bit of personalization kind of come back in that area as well.
Interesting. Yeah, that's a whole other world of training and and onboarding. Yeah. Yeah, I saw one organization that went live with both, and it wasn't clear if they liked that choice or not, to do both at the same time. So it'll be interesting to see how that plays out for sure. As we kind of wrap up, Rajiv, I'd love to hear like how do you summarize how this Epic Go Live went and some of the key learnings from this Go Live and this experience?
I really felt the go live went really well. It was, I think they took the time and effort to prepare. And it was great to work in partnership with them. Everything we needed, Care New England was able to kind of give us the tools to help us succeed and in turn for them to succeed. And I think we needed to hit certain metrics for, personalization. We hit those metrics in a timely manner, but that was only possible because we did it in partnership. Um, in terms of kind of like at go live, it was a very typical go live. There's always, the craziness of the first week,
Yeah.
but I think we got got a lot of the physicians like on a good start. And one of the things that we did is we made sure that we kind of, our team had consistent contact, obviously with Dr. Helvey and then also other CMOs in the health system. And what that we were able to kind of, the first person to hear about someone really struggling is the CMOs. or the service line leads. So they had that direct line of contact. So when we were doing that, the elbow support, they were able to kind of go out and be deployed. And I think that helped put out like fires before they even started, and helped make everyone feel kind of like their needs were being met with the support that was available to them. And I think in turn that made the go live a little bit smoother.
Nice. Sarah, what would you add? And any things you're really proud of, and maybe some lessons learned too, for anyone else that is going to go through the same experience.
Yeah, I mean, I would also reiterate what Rajeeb said, that the partnership with them was integral to being successful. I also agree our go live was pretty by the book, which is where I would like to be. I mean, I definitely don't want to be under the book or the book on top of me, anything like that. So, but we did have our issues. I think that with when we the three-pronged process, as you mentioned, pre-go live, go live at the elbow, plus go live post personalization, really pulled the whole picture together. And it was nice because a lot of our providers who were doing the personalization labs pre-go live, they then came on site and they got to meet them and they got to work with them and they would
Well,
come in
that's
the
cool.
office all the time. So it just kind of it's that customer service that you want to give to your physicians, your clinicians. And they, as Rajiv mentioned, yeah, we're a relatively smaller organization overall. And so we were able to really have our leaders. We have great CMOs here, by the way, and they were very involved. They are very in tune with the physicians that they work with in our different hospitals, our different locations. And yes, when there was a fire that came up or whatever was coming up for that day, they were really right there with the ReMedi support staff or ReMedi physicians, able to communicate that to them, and they were able to deploy. And we did well enough that ReMedi was really our main physician support. We had another company here, but they were doing, who was great, but they were doing some more of the other ATE support.
Mm.
And we didn't really have that many ReMedi physicians overall, but they were able to be so impactful with the numbers that they had. And in part because of that communication we had amongst all prongs of this approach that we took, amongst all the different groups, being able to deploy, be involved. Our chief of hospitalist medicine, our chief of surgery, that everybody was involved. Everybody knew ReMedi, everybody knew who they were, and we knew how to deploy them appropriately. So those are some of the positives. Lessons learned. I think if I could do anything about how we couldn't move our build in from that Cerner to Epic conversion, I don't know if that's something I could have ever changed, but maybe being more aware, because that was something that came up as a surprise that we didn't expect there to be that inability to literally move some of the build. And that messaging had to come kind of last minute. And I think that did induce some frustration with our providers. But, again, I think ReMedi was able to really pivot well there and communicate with our docs and make sure that they understood that it was going to be all okay at go live. And then I think we did do a nice job of being able to make a lot of quick changes early in go live for some of those things that just really weren't working. And we had a really great command center that we were able to, we had all the people that would escalate, escalate, escalate. So we were really on top of the big escalations because we were really, I don't know, we had each OU and then we had a main command center and we were all in a room, if you will, but on Zoom, but we were all still in the same room 24
Yep.
hours a day. And I think that really helped us get through the go live.
Amazing. Well, I think anyone that's been through a Epic Go Live understands and appreciates all the hard work that you both did to make sure it was a success for Care New England. So I appreciate you both coming on to share about your experience and help other organizations so that are looking to do this as well to make sure that they have a good experience. So thank you so much to both of you for taking time to talk with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Rajeev. Thanks, Sarah.
Thanks for having
Yeah.
me.
Yeah. Thanks for having us, John.